The major complication of a sleeve, or the most worrisome complication of a sleeve, is a leak, and that is through the stapler line. If the stapler line gives way and the stomach contents tend to come out. So if that happens, you need further surgery or endoscopic procedures to correct it. The other common complication that can happen is bleeding, because we dissect blood supply to the greater part of the stomach, which is also shared with the spleen. So there is a possibility that there can be bleeding that happens during surgery, or sometimes, very rarely, that happens after surgery. If this happens, then the bleeding has to be controlled. If it is during surgery, it's straightforward, but if it's after surgery, you need to have another procedure to control it. In addition, another known complication is reflux, which happens after a sleeve. So if you look at the mechanism of the sleeve, the stomach, which was like a bag and it was a high volume reservoir, becomes a thin tube after formation of a sleeve. So this becomes a thin high pressure tube from a wider reservoir. So the natural tendency is for the sleeve to reflux things up into the esophagus. So within the first 3 months, we prescribe you a proton pump inhibitor or a tablet to reduce the acid. And usually at the end of this time, there is no major complaints of reflux. So it's important that you discuss with us if you have had previous reflux, because if there is significant reflux and a hiatus hernia, then this has to be either fixed during surgery, or we have to opt for other weight loss procedure like a bypass. The other complications of sleeve is long-term. There could be vitamin and mineral deficiencies if you don't take the dietitian's advice and take the multivitamins tablets long-term. And this is recommended that you take these tablets lifelong.